Hi guys, this is Kathy, Zanab, I'm Elvi, this is Annie, and that's Claire. We're going to be talking about the Afghan culture, for which we interviewed Zanab's mother.
One of the questions that we asked her was about the practices that promote or impact health or prevent disease. Access to healthcare is not available outside of the major cities in Afghanistan. Therefore, much of health promotion rituals are done within the home because of the culture and lifestyle that the Afghans live. All year long, the local people receive a variety of nutrients and eat organic foods because the majority of people are farmers. A lot of the different spices and seeds are used to build and maintain a strong immune system. A few examples are fennel seeds are consumed for digestion. Turmeric helps heal wounds, improve depression, and has strong antibacterial properties for stomach ulcers. Ginger root is also used in cooking for flavor, but also aids in nausea and indigestion. Cinnamon is used for palpitations, and raw honey is used for cardiovascular issues. Cucumber with lemon and garlic is used to decrease hypertension. These spices are beneficial for building and maintaining a strong immune system. An herbal detox named Palouse is done every month as a cleanse.
So one example of health promotion within the Afghan culture is the postpartum care that is given to women after the delivery of their baby. And traditionally, a woman and her newborn cannot leave the home for 40 days after the birth of the baby. The birth is done within the home, and for 40 days, the woman is called zacha. The 40 days is used for the body to heal from and recover from the birthing process, and during this time, the woman is exempt from housework duties and sex. It is the mom's duty to take care of the baby and get on a normal breastfeeding schedule. During this time, the baby is not taken out of the home in order to build up its immune system, and at this time, the sister-in-law and the mother-in-law will also be preparing the meals and taking care of the new mom. During the 40 days, the new mom will eat certain foods. In the morning, she gets 3 or 4 fried eggs, and in the afternoon, she'll get a whole chicken. So foods high in protein are cooked so that her body can heal and recover, and as well as promote breast milk. The mom will also consume a lot of ginger tea and pregnancy soup, which is called shira, and it's based with flour and water and has walnuts, cardamom, ginger, and raw brown sugar added to it as well.
As far as the communication style preferred in the Afghan culture, the language of their native tongue, is Pashto or Dari. Handshaking is not a way of greeting people, and eye contact between unrelated males and females is not done. With regards to healthcare decision-making of the individual and the family, assumed within the culture, the eldest of the family makes the healthcare decisions of the family. Individually, a female would be accompanied by the eldest of the family to see a provider. If she goes with her husband will speak for her. If a woman sees a provider outside of the village, she will never travel without a male relative.
Now we're going to literature. In 2002, Afghanistan's government implemented a basic package of health services, BPHS, contracts primary health delivery to non-state providers. The priority is to give access to vulnerable groups in Afghanistan, such as disabled people, women, children, poor households. And then in 2005, it was revisited, and BPHS, they discovered that the BPHS clients have more out-of-pocket expenses, and they don't travel to the clinics as much because of the time spent traveling. In 2008, Afghanistan deployed 28,000 community health workers, CHWs, to enhance coverage and health outcomes and ensure basic care and preventing diseases. They care for the vulnerable groups, again, providing equitable, accessible, affordable 24-hour care. The CHSs allowed women more independence and to travel without their family male escorts.
One common disease process in the Afghan people is GERD, which is thought to be caused by their spicy food and the fact that they eat dinner so late at night. One of their remedies is called kapa, and it's a combination of spices and seeds like fennel and cumin that are ground into a fine powder and then taken with a full glass of water. Other health concerns would be cancer, hypertension, depression, and opium addiction, as 90% of the world's opium comes from Afghanistan. Life expectancy is quite low. The average, according to the CIA fact book, for males is 49.5 years and 52 years for females. The theory of transcultural nursing. For preserve and maintain, the Afghan people use homeopathic remedies for GERD, and this should be respected by the provider and or the healthcare staff. To accommodate and negotiate in the clinical setting, when the nurse takes record of all the current medications, the nurse should also ask how much of the homeopathic remedies and herbs they're taking and if it helps their GERD. to repattern and restructure. Depending on how well the homeopathic remedy is working to treat the GERD, the doctor may want to also introduce prescribed medication in which the nurse would take time to explain it, how it works, the length of the treatment, the importance of it, and the possible side effects. Also, it is important to know if the new medication can be taken with their homeopathic remedy. And that's all.